Hello, Terrence. Friday. Thank you for joining us. The annual enrollment period for health insurance begins next week, and during that time, you can actually make some changes to the kind of healthcare coverage that you have for the following year. Now, this period can be a bit difficult to navigate for a lot of people, especially those who are eligible for Medicare. So joining us in studio to give us some details and kind of help you walk through that process is Kyle Ingraham, the manager for Medicare and Individual Sales at Health Alliance Plan, and Natalie Pirkola, the Senior Vice President of Pharmacy. Thank you both for being here with us.
Thank you.
Thank you for having us.
So this is an important time. People have a lot that they need to know. Natalie, before we get into that, let's just know more about your company and your background in that.
Well, we're proud to be here as part of Health Alliance Plan, or HAP as we're commonly known. We've been in the Michigan marketplace for over 60 years. Born and bred here in Michigan, and we think we're the home for health insurance. We've got a lot of offerings for people in commercial, Medicare, Medicaid. So today we'll be focusing on the Medicare offerings. As you mentioned, there's a lot of things to think about when you're trying to pick the right plan for you.
Yeah, there is. And I'd imagine that with so many specifics, you want a professional on your side who can help you walk through those things.
Absolutely.
Okay, so what are some of the main things that people need to know so far this year?
So the biggest thing to know is the annual enrollment period that's coming up. That runs from October 15th through December 7th, and that's where any Medicare member with Parts A and B are able to make a change to their insurance, whether that be a Medicare supplement plan and a prescription drug plan or a Medicare Advantage plan.
Okay, and who does this apply to specifically? Like, who really needs to make sure that they're paying attention to this?
Anyone on Medicare. So it doesn't matter if they're over 65 or under 65 and they qualify for another reason. You want to make sure that you're taking a look at your Medicare choices every year, because your health change, you may have changes in your health, you may have new prescriptions or something else, so you really want to work with a local agent every year to review your case and make sure that you're still in the right plan for you.
Okay, and it's important to note too that when you make these changes, it's pretty much locked in, right? So you want to make sure you're making the right decisions.
Well, and there are plenty of experts to help. As Kyle mentioned, there are local agents and brokers that can provide effective information. It's important to think about things that you use a lot. So looking through plans, there are many with $0 premiums, which can help with budgets. I know a lot about medications, so people commonly use medications. Many of them are offered at $0 in a common tier. Low numbers of tiers are often less expensive. And there's been a number of great changes to make sure that everyone has access to vaccination, like flu vaccine, COVID vaccine, et cetera, at no cost, regardless of which type of plan that you're in. So it's also important to think about how often you see the doctor and what conditions you have to manage. That way you can help understand the budget and how often you need your plan to be doing work for you.
Okay, Kyle, are there any specific changes that people need to be mindful of going into this planning process?
So no specific changes to Medicare as a process in a whole, but every year the plans may change. They're going to be receiving, if they've not already, their annual notice of change for their Medicare Advantage plans. It's going to let them know what is different about their plan this year, and that may prompt them to even reach out to that local agent, go online and do some research for themselves, because maybe that plan changed in a way, that doesn't fit their current situation, whether it be a copay raising or decreasing each year.
Okay, Natalie, when someone comes in, just walk us through the process that you go through with them. How does it work? What do they need to bring? What do they need to know?
Most often for me as a clinician, it circles around who's their provider. So is their doctor within the network? What prescriptions they have. So many times we call this a brown bag. They'll bring it in some type of bag to make sure that we can see where are those drugs on the formulary, how affordable are they, what's the relative cost. Those are two of the biggest things. One thing that when I'm talking to individuals, I want to make sure that they do extra homework to look for are those supplemental benefits. This is a big difference between regular Medicare, where they're split up into the parts that no one ever remembers, the A versus B versus D. Going through and picking a Medicare Advantage plan lets you get a whole package put together, helps you get copays instead of percents that are sometimes a little bit more difficult to manage, and comes with wrapped in supplemental benefits like dental, vision, flexible cards for spending for things that include over-the-counter medications, and many times now even groceries.
Oh, wow, so that covers a wide range.
It does, much more than the traditional benefit, and that's the flexibility of bundling everything together rather than needing to choose them each separately.
Now, Kyle, if people miss this deadline, how detrimental could that be?
You're locked in for the next year. So it's very, very important that you look into your plan, talk to somebody, have your different things, as Natalie brought up, taken a look at. If, for example, gym memberships or fitness benefits. Is the gym that you're going to still in network with your current plan? Have you been utilizing that type of benefit? Are you looking to be able to order OTC items through a catalog, or do you want to use them at a store via a flex card or some other kind of benefits? Those are the things that change for people year after year, and you want to make sure that your plan is still fitting you.
Okay, and I know that these changes apply to the following year, but if someone goes and does this paperwork, but then they realize they left something off, can they go back?
Great question. So the annual enrollment period is what we call last application in. So you can make multiple changes throughout AEP. If you decide you want to try one plan and then you have buyer's remorse and want to go back to the plan that you were on, you're able to do that throughout AEP. It's just your final selection on December 7th is the one that will be with you for the next year.
Gotcha. So just get past that barrier and then we can
Right.
work with it. Okay, anything else that people need to know or just make sure that they're mindful of?
So one big thing I do want to bring up is the scams that you hear about. And that's people getting phone calls. I promise you, Medicare is never going to call you and ask for your Medicare beneficiary ID number. They're not going to ask you for your Social Security number. They're not going to ask you to make a plan change and say that they are Medicare. So just be mindful. If you are working with an agent and you get a phone call like that, my suggestion is to hang up and just call your agent and make sure that it's something valid. Same thing with the plans. We're not going to call you and say, hey, you should change your plan. Make sure that you are speaking with your agent and getting all the proper information, because we really want to make sure that our members are taken care of. At the end of the day, this is about taking care of our Medicare beneficiaries in the state of Michigan, which is something HAP prides themselves in.
Okay, and for people watching, how can they get in contact with you guys? What do they need to do?
Yep, so they can go to www.hap.org/Medicare, or they can call into us at 1-800-803-8005.
All right, thank you so much. We appreciate it. Hopefully this helps a lot of people. Got to get to that deadline. Don't forget to do your homework, right?
Thank you very much for having us.
Absolutely.
All right, here in studio with us again, Kyle Ingraham and Natalie Pirkola from the Health Alliance Plan for All. The valuable insight that you've brought has definitely been something that we've needed to discuss. Again, we thank you both.
Thank you.